It's very easy for me to call someone sleazy or a nympho or amoral because of their sexual behavior. And in the moment, they may look sleazy or amoral or perverted or whatever you want to call it. But think about the heroin addict who may take every penny of money saved for their kids' college future out of their college savings to buy heroin. And yet when sober and working on himself or herself, that heroin addict might work 3 jobs to put that money back in the bank for those kids. In other words, people are in the spell and the experience of addiction are not thinking clearly, and they're not making good decisions, and their priorities shift away from the things that are really meaningful to them, like family and work and education and relationships, toward one thing, the thing that they're addicted to, and that becomes a priority in their life. And if a drug or a substance or an experience becomes a priority over family, friends, community, you're going to look kind of sleazy. You're going to look kind of perverted. You're going to look kind of immoral. That doesn't mean you're a bad person. It might, however, mean that you're kind of a broken person. And when we have people who are broken, we create diagnoses so we can understand what's wrong with them and then create treatment plans to help them. So we are very much right at this moment, and probably part of the reason why I'm able to bring these videos to you is we are right at the moment where the World Health Organization has announced that sexual compulsivity will have a diagnosis in 2018, which means that we are now considering this as an issue. It is a real live issue for people to deal with. And you, as a therapist, as a counselor, as a support person, you're going to have to understand what this issue is about, because if it's in the ICD-11 or in the DSM, that means you have to treat it. So here I am to let you know a little bit about what sexual compulsivity and addiction is all about. And we're going to study that at a whole bunch of levels. Let me first say, though, why I use the word addiction. The word addiction is stigmatized. It always has been. And so when there are people, certainly in America, in the sexual health world, who really don't like the pairing of the word addiction and sex, because it makes it sound like sex is bad or sex is wrong or sex is dirty, and therefore they would rather use words like compulsivity or other words to describe repetitive problem sexual behavior other than addiction, because they don't like the word addiction. And there is a problem with that. When you say you're an addict, if you see yourself as an addict, then you have available to you a lifelong lifeline to 12-step recovery and support. In other words, if you're an alcoholic, you're going to be an alcoholic your whole life. And thank goodness that you have AA, because you can always go to a meeting, you can always get a sponsor. If you have a slip and you start drinking, you can go back to those rooms and those people will pick you up. They'll give you a seat on their couch for a few weeks if that keeps you sober. People will be there for you. That's their job in those rooms, to help the newcomer. Well, guess what? If you have a sexual disorder that's compulsive or addictive in nature, you have it for life. So what is 2 or 3 years of therapy going to do? Yes, you may learn how to get around it. You may have to learn how to stop it. I mean, we can teach people how to heal and grow, but it is a chronic emotional condition, just like any other addiction. Under stress, when that person is having a difficult time, it may come back. And certainly the desire to sexually act out will be with that person the rest of their lives. So why would we assume that 2 years of therapy is going to be the answer? It's not. 2 years of therapy or 3 years of therapy or 6 months of therapy or whatever you give them will put them on the right track. But where is the person going to go who has a sexual problem that can't afford therapy? What about the person who's already been through therapy and they really get the message and they know what they need to do, but they're in trouble and they're slipping and they need a place to go to get support? Do they have to go back to therapy? My belief about addiction and the word addiction and what the world of addiction offers is it offers a lifeline tie into community, where there are groups and individuals who will sponsor you, who will support you, who will help you online, who will be your social support, who will guide you, who will give you direction, hope, and shame reduction in group and individually without any cost for the rest of your life. And you just can't get that from therapy. So I claim the word addiction because I think it gives people a lifelong opportunity to get support without cost and to be able to change their behavior without necessarily maybe ever making it to therapy. And I know they say in Alcoholics Anonymous, and I agree with them, that far more people got sober in AA than ever got sober in therapy, because it's in community that people heal from addiction. And it's in community that they remain sober. And when you take someone who has a sexual issue that's addictive and you put them in an individual therapy situation, they may learn a whole bunch of stuff, but their sense of belonging and connection, their sense that I am not alone with this problem and that I'm not the worst person in the world and there are other people like me and oh, you did that too, all of that doesn't happen unless you have a group. And you'll hear me say again and again that the primary milieu focus for treatment with addicts is group. Group is where it's at with addicts, and especially with sex addicts. So if group environments and social community is what is healing and supportive, why wouldn't you want to call yourself an addict? Because as an addict, you can find a lifelong tie to meetings and support at no cost forever throughout your lifespan, unlike therapy where you're going to have to pay somebody or take the time to go. So that's why I use the word addiction. A lot of the arguments in the field are about compulsivity and addiction and hypersexuality is about what to call it related to brain research or what to call it related to technical terms and ways that people think about addiction or compulsion. Or I got to tell you, who cares? What I know is that people go to meetings and they call themselves sex addicts. People go to meetings and they call themselves porn addicts. People have a problem with this issue. In the general population, say I'm a sex addict. Just like people have a problem with alcohol, most of the time they say I'm an alcoholic. They don't say I have a substance use disorder, even though the word alcoholic no longer appears in the DSM-5. It's substance use disorder. So there is a schism between how ivory tower folks, mainly who are not doing treatment and not applied work with clients, think about things and use terms and words. I think that's very different than how those of us who are actually working with people in real time on the street need to use words that are useful to them, like the word addiction. Because I don't really think that calling it compulsivity tells somebody a whole lot about how to get help throughout the lifespan or the nature of the problem they have, unless you're a therapist, and most people aren't. So that's a little bit of my take on why we use the word addiction. And if you use the word addiction, you have to understand that there are 12-step groups and support groups throughout the world for alcoholism, for drug addiction, for sexual issues. And even if you live in a country or a place where there are no support groups like that, they're all online. So SAA, SA, SCA, SLA, SRA, all of the S programs for addicts and all of the S programs for partners, just like AA or NA or any of those, they're all available online. Meetings, groups, getting together. You can find me online, by the way, on a regular basis on sexandrelationshiphealing.com because I do a weekly webinar for sex addicts and sexual compulsives. And I have people from all over the world asking questions. You know, I'll get 150 people in a webinar on a Friday night or a Monday night. And they're in Dubai, they're in Japan, they're in Australia, they're all over the world. And I'm sitting in California talking to them. But this is the gift of technology, is that I can support them at no cost to them all across the world. And that's what the 12-step environments offer people.